Hello everyone. My name is Paula Richardson, and I'm going to be presenting obesity in women from a gut perspective, a very unorthodox way that we talk about obesity and how to get well. So put your skates on, all right? Because we're going to go through a lot of a deep dive and the root cause of obesity and how we can identify healing opportunities to help ourselves. So a little bit more about me. My name is Paula Richardson. I'm a registered nurse since 2003, a family nurse practitioner since 2012. In 2017, I went back and got my adult gerontology acute care nurse practitioner, and I'm currently a functional diagnostic practitioner student. I'm the owner and the founder of Top Notch Health Solutions, where I focus on obesity, metabolic health, and gut health. In our office, totally, we are now almost 4,000 pounds down collectively between all of my clients, including myself. So I want to start off because this is very passionate for me. I myself have battled with obesity my whole life. And I have finally found a way to identify the why and how I need to address it by navigating gut health. So my wellness journey, where I felt like enough is enough. I was 302 pounds, just a lack of energy, mood swings, brain fog. I was a 28 in the waist. I couldn't see my feet. My health issues were mounting. I literally started working out, deprived myself, and the weight would not move, and I would give up and start back on my unhealthy journey. However, the first thing that changed my life was that I started on the weight loss injections, and they worked. And I lost 20 pounds in a 3-month period, more than what I would lose if I would aggressively work out and restrict myself from certain foods. And I began to wonder, how is this medication working for me? What is it doing to me that I can't do for myself? And it led to me checking my gut. So a little bit more about me. I was 40 years old on 5 prescriptions, 3 for high blood pressure, 2 for diabetes. I had swelling in my legs where I couldn't wear sandals. I began to have sensitivity issues where I could not get my feet done. I could not put my feet in cold water. I ended up being diagnosed with Raynaud's disease in my lower extremities. And I said to myself, if I'm like this at 40, then what is 60 going to look like? I honestly got used to being big. I got used to waking up tired. It just became a part of what was normal to me. And so when I went to several physicians to evaluate my legs that were not just swollen, but they also developed a blue and gray color. And I went to my primary care. She said that my legs were fine. I went to a vascular place, and they told me I had no clots. I'm not losing my legs. I went to a cardiologist. I'm like, listen, my legs are swelling. They're blue and gray. I can't wear sandals. Something's wrong. He also told me that I've had the right studies. Nothing was wrong. I then went to a physician who put blood pressure cuffs on all of my toes and asked me to put my feet in cold water. And that's when he diagnosed me with Raynaud's disease in my feet at 40 years old. Raynaud's is an inflammatory condition that I would often see in my elderly female patients who were Caucasian, and it would be in their hands. Here I am with it in my feet at 40. And he looked at me, and this was a major turning point in my life. He said, you have 3 organs down. And I'm like, whoa, I'm down. He told me my heart, my endocrine system, and now my vascular system. And he looked me in the face and said, what are you going to do? All right. So that's when I started the weight loss injections. So on the injections, of course, they're supposed to help decrease your cravings. So when I say injections, I mean the GLP-1 therapy. And when it cinched my cravings, I identified a lot of why I was really struggling with trying to lose weight. I wasn't eating breakfast. I was barely eating lunch. I was on the go. And on the way home, I literally figured out why I was binge eating. And I didn't even know I was binge eating until I started the shot, and it cinched my cravings. And in doing a thorough evaluation of myself, I want you to clutch your pearls. This is the reality for me. I'm very free from this. But I was eating 6 tacos with 18 fire sauces, a king-size Reese cup, and a sun-kissed drink on the way home for a snack. And the shots just changed all of that. Like, I literally had no cravings at all, to the point where I didn't eat because I didn't have healthier foods in my wheelhouse. And when I say wheelhouse, I don't mean physically, but also mentally. The way my life was going, I was always eating on the go. I was always eating quickly. And I just set my body up with an insulin resistance, diabetes, a weight loss resistance. So in evaluating how the injections work, I identified that my gut health was so poor that I was missing the bacteria that does what the shots do, okay? So women are 40% more likely than men to have obesity, okay? All right, and so obesity affects us in many different ways. Fertility, hormonal changes, increases our risk for heart disease, metabolic disease, which is high blood pressure, insulin resistance, high cholesterol. It increases our risk for diabetes and breast cancer. So the prevalence in obesity overall is very high, but women are 40% more likely to have obesity. So I call this, and I'm gonna do a little deep dive here. I call this my wellness iceberg. So, you know, when we see an iceberg and we're on the surface, we see the ice that's coming out of the ocean, right? So this is what we see. We see obesity. We see diabetes. We're diagnosed with multiple diseases, edema, high blood pressure, insulin resistance. We may even have some stomach issues, but brain fog, cravings. And again, we kind of learn to live like this, and we try, and you know, we all try to some extent to help ourselves, but it's not always very easy, okay? And so what we see are these things here. I'm obese, I cannot lose weight, I have cravings, but what's really happening is under the surface here, okay? So here we have the iceberg that we see, but underneath the water is the source and the root that is contributing to continued obesity, okay? Even in clients who've lost the weight, there's a continued issue with some of these diseases, okay? So underneath here, where you cannot see the danger, is inflammation, bad gut bacteria, poor digestive function, meaning you're not really absorbing the nutrients that you should have, leaky gut syndrome, again, creating a lot of inflammation. We may not have enough of the healthy gut bacteria, which I'm about to talk about. Liver congestion, poor cellular health, okay? Poor gut health overall, and poor gut immunity all make an impact on our metabolism, our metabolic health, and and on obesity. So I'm gonna talk first about cellular health. Our body is made up of a bunch of cells, okay? From the time we're conceived, we are divided up from a bunch of cells. These cells create every single organ, okay? And it creates who we are, the entire body. I say this because your gut plays a huge influence on cellular health. We have to learn how to heal ourselves from the inside out, okay? So cellular health is key to optimal wellness. Yes, we have obesity. At the end of the day, what we really want is longevity, resilience, and vitality. And the weight will come off if we deal with the inside out. So this is the little picture of a cell. This could be a brain cell, an endocrine cell, a cell for your metabolism that helps with weight loss. So we have this cell here, and it has these receptors here, okay? The green area here is the nuclei here, where it has the powerhouse of the cell. It's called ATP, okay? Then you have where the cell receives signals, okay? So let's just say, for the sake of the presentation, this is a cell that helps with metabolism, all right? So it should be receiving signals to transmit energy and to exchange energy. That's what weight loss is. It's an exchange of energy to support metabolism. What I found in my health and in most of my clients is that our cells are not receiving these signals. And so it's toxins covering these receptors, okay? And what could those toxins look like? Could look like stress on the body, okay? From lack of sleep, not the best diet, lack of exercise, inflammation, exposure to toxins in the environment. And this can create a weight loss resistance where it is very hard to lose weight. Okay, so if you have diabetes or insulin resistance, this can be an insulin cell that's not able to really exchange and receive the right signals for it to give us what we want. At the end of the day, we have to give the body what it needs so we can get what we want, okay? And so one of the first things that I do with clients is detoxify these areas from a cellular perspective so the body works by itself. We are made up of a bunch of cells that function without us knowing, without us telling them what to do. We were designed perfectly. So if we give and fuel the body properly, then the body knows how to respond. So, as I mentioned, gut health plays a huge role on cellular health, okay? So gut health is related to metabolic disorders, which I mentioned, obesity, diabetes, high cholesterol, insulin and weight loss resistance, cravings. Yes, our gut health plays a huge impact on our cravings and desires. Yes, amongst the other things I have listed here. So I want to talk a little bit about how this works. So for my clients and there is a gut imbalance, okay? All right. So you're missing certain types of healthy gut bacteria and you have an elevation in unhealthy gut bacteria. Guess what? These toxins from these unhealthy gut bacteria communicate to the brain. Yes, they do, okay? And they release hormones that communicate when you're hungry, thirsty, or full. They also have an impact on your metabolism. And these healthy bacteria that we should have, they break down carbs, sugars, and helps us break down fat. Also, the unhealthy gut bacteria, they love sugar. So guess what? They communicate to your brain, crave, we need carbs and sugar. These unhealthy bacteria love it. So then I'm going to use me. I'm craving carbs and sugar, and guess what? Taco Bell, Reese Cups, okay? All right, and so then it leads to obesity and a progression of diabetes, high blood pressure, metabolic disease, and much more. The reality is, before we are diagnosed with anything, there is a season where the body is already going through changes, okay? And so even before we're diagnosed, when we are navigating our wellness journey, our choices impact our body well before disease, okay? So Healthy gut bacteria, what do? All right. So certain bacteria are linked to weight gain. I'm going to show you in just a minute. Okay. Others are linked to a healthy weight and weight loss. Yes, there are certain bacteria that if a client has a very diverse amount of balanced gut bacteria, they're likely to be lean. And there are certain bacteria where you're likely to battle with obesity. All right. Your gut also assists with digestion, okay, and absorption. So if we're eating, even if we eat healthy, if the gut is unable to absorb and pull those nutrients to provide the body what it needs, then guess what? The body is not going to respond to your weight loss measures, okay? So your gut, your intestines has to also be able to effectively extract nutrients and eliminate toxins properly. Next, we all hear about inflammation a lot. Guess what? Chronic inflammation can cause weight gain and hinder weight loss. 80% of our immunity is in our gut. It regulates our inflammatory responses. So if you have a lot of unhealthy gut bacteria and you're missing some healthy bacteria that fight inflammation, then you are at a high risk for inflammation. I don't care how much turmeric you take or whatever you take, an anti-inflammatory diet, if the gut is set up like this, then it's just a spiraling journey, okay? Appetite regulation. Yes, the gut controls appetite regulation. Again, the bacteria in your gut or the lack of healthy gut bacteria communicates through hormones regulating appetite and cravings. So just want to simplify this little diagram here. So we're going to start right here. So if we have pathogenic gut bacteria, which are unhealthy gut bacteria, they promote obesity and inflammation. This increases cortisol levels. The stress on the body is trained to increase cortisol because it thinks it has to fight. This increases hunger and fat storage. Once we have consistent elevated cortisol levels, then we develop an insulin sensitivity issue where there's a lot of resistance, okay? Where we have decreased insulin sensitivity because our cortisol levels are so high all the time, the body cannot fight it and it begins to lose its ability. And that is where we start getting pre-diabetes, diabetes. But remember, there's a season before diagnosis where these things are already setting up, okay? So nevertheless, during this time when you have decreased insulin sensitivity, you have an increase in fat storage. And guess what? Also with this situation, increased cortisol levels, increased stress on the body. That means physical stress, physiological stress, emotional stress. You have an increase in a hormone called ghrelin that further increases hunger and fat disposition. Yes. And then it decreases your thyroid hormone and then decreases your metabolism. It's a vicious cycle, okay? All right? That can start anywhere in here, but if you have a bad gut or an unhealthy gut, then the body physiologically, no matter what you do, is having this cycle that's occurring, okay? So here's an example of my gut health, okay? All right. So I was missing healthy gut bacteria. Akkermansia, if you see this right here, Akkermansia is undetectable on my gut analysis. This bacteria breaks down carbs, sugars, controls insulin levels, and weight. And it also prevents inflammation. I have absolutely none of that, okay? Have none. So guess what missing Akkermansia means, okay? According to the NIH, Akkermansia is a mucin-degrading bacterium commonly found in the human gut. It's a healthy gut bacteria. Amucinophilia has been inversely, meaning if it's low, the risk is high, okay? Amucinophilia has been inversely associated with obesity, diabetes, inflammation, and metabolic disorders, all of which I've battled with for 20 years, okay? So I could work out, I could eat right, but if I'm missing this healthy gut bacteria, that's a powerhouse of my metabolism and my metabolic health, then guess what? I'm fighting a brick wall, okay? Also, Akkermansia secretes a glucagon-like peptide 1 inducing protein that improves glucose homeostasis and ameliorates metabolic disease in mice. So we've all been hearing about the new GLP-1s, right? So I want to say this again. Akkermansia secretes a glucagon-like peptide 1. It secretes what the injection has in it. So I was missing the healthy gut bacteria that does what the injections do. That's why it worked for me so well. And I began my journey to figure out, how do I heal myself? Also, in addition to having a low amount of healthy bacteria, I had an overgrowth in unhealthy bacteria. I had Enterococcus, Pseudomonas, which is green and smells like trash. And if diabetics or anyone gets it on their skin, it's gangrene type bacteria that was seeded throughout my gut. I had a high amount of staph and strep in my gut. All of this leads to inflammation, okay? Obesity, weight loss resistance. A lot of our Western diseases are linked to inflammation. And remember, 80% of our immunity is in our gut. It regulates our inflammatory responses. So if I have all of these toxins, these bacteria releasing their toxins in my body, then guess what? I'm inflamed. Okay. In fact, I had leaky gut where my gut allowed these unhealthy bacteria to seep into my bloodstream, and that's where the immune response occurs. Okay. So this is a picture of Pseudomonas on a wound. Okay. This is on a wound. And I had high amounts of this in my gut. Okay. No, I wasn't sick. I didn't look sick. I wasn't, one of my patients in the ICU, but I've seen clients with this in their bloodstream. And I'm thinking, wow, I have the unhealthy things in my gut that my ICU patients had in their bloodstream. I was like, wow. And it all drives obesity, inflammation, and whatever issue that you have. So again, here's an example of another client's results that are just full of a lot of unhealthy bacteria, okay? Even ones directly related to inflammation and autoimmune disease. This is what an unhealthy gut can look like. I have a client here with parasites, okay? Parasites, again, they suck the life out of your food before you get it, okay? They release a lot of toxins that cause inflammation, again, that can lead right back to obesity. Fungus and yeast, yes, all of these bacteria can make you crave, okay? But yeast, they specifically love sugar. And you would crave and crave and crave for sugar and not realize it could be yeast. So I want to talk a little bit more about the effects of inflammation on the gut and leaky gut syndrome, okay, which is linked to a lot of our Western diseases because of inflammation. So here on the left side, I have a healthy gut, okay? So follow me on this. You see the tight junctures here. You see the mucus that's covering these little, I'm gonna call them little fingers here, okay? And then you have your bloodstream, all right? So this is our intestinal lining. This is the area of our intestinal lining that absorbs our nutrients for us, okay? We don't live in a bubble, right? So we are exposed to toxins, but see, toxins are not able to be exposed to these areas. They bounce off and are removed from the body, okay? All right, so this is a healthy gut lining. When you have a lot of inflammation, like what I had on my gut analysis. And when you're missing the healthy gut bacteria that creates this mucus here, then your gut can look like this. And it's called leaky gut syndrome, where it's very red and inflamed. These junctures here they're wasted away. There's no protection here, okay? And so viruses and gluten and the bad gut bacteria and toxins, they leak through in between these areas and they hit the bloodstream. And this is where our immune response literally sets off. And that, again, for the sake of this presentation, obesity is linked to leaky gut syndrome. So you can eat right, you can work out, but if the body is set up like this, then it's just, you're going to hit a brick wall, okay? I even find clients who have tried GLP-1s and they don't work, and it's their gut. Their gut is in such bad shape that the medication, it doesn't respond, okay? So dealing with your gut is a very key aspect of obesity and healing yourself from the inside out. The reality is, if we give the body what it needs, the weight will come off, okay? But healing the gut is a key aspect of this. So what did I have to do, or what do I have my clients do? We have to detoxify, because as we start our wellness journey, we want to give our body a clean slate. The reality is we haven't been making the healthiest decisions based on whatever we have going on in our lives, but we're trying to get our lives together, right? I didn't want to be on 5 prescriptions at 40 and then be on more at age 60. So what we do here, we open the drainage funnel. That means we bind up toxins in the blood and the gut. We clean the liver and kidney holistically, and we open up the ability to detoxify. We focus on boosting gut immunity, restoring the gut lining, killing off unhealthy gut bacteria, and then focusing on the recovery phase. So this way, our food and our exercise, our nutrition works for us. So a part of this is also understanding balance. The body needs balance. The reality, like, we have a busy life. We're running around, we're stressed out, we have families, we have our job, but we've got to slow down and we've got to give our body what it needs, and it likes balance, okay? So first of all, the diet, 80% of the time, we've got to choose healthier options. I don't say food is good or bad. I say it is healthy on a continuum, and I cannot eat unhealthy like I was 80% of the time. I'm gonna say 100% of the time, eating that many tacos almost every day of the week. Our rest, we gotta get at least 7 hours of rest. Yes. The body needs time to restore itself. If we're on the go, those cortisol levels are they're constantly high, and it creates an insulin resistance where the body is trying to balance itself. But if we're not getting in bed till late and we're not getting consistently 7 hours of sleep, the body cannot rest and restore, okay? All right, exercise. Movement is key. The body is a machine. If we don't move it, we'll lose it. So whether it's walking, whatever you can do, please get moving, okay? We all have read and understand that a sedentary lifestyle leads to high risk for obesity and everything that comes with it. So find time to give your body what it needs. And in my journey, I had to understand this. I will serve my physical temple, my physical body, just as much as I serve everyone and everything else. It's only one me. Okay? All right? Stress. Yes. Stress is huge, right? And so finding ways to alleviate stress is also very important. So when it comes to nutrition, so we should try to eat more of healthy fats, okay? Healthy fat, lean meat as much as possible. What I find in dealing with myself and a lot of my clients is that We actually are eating carbs and sugar constantly based on what's around us. And so literally getting your salmon in, your omegas in, getting a variety of healthier foods in your diet, your body will respond, okay? All right. I don't suggest missing meals. If you don't have a good breakfast, maybe a smoothie, some type of greens and fiber in a smoothie to help boost your day, to help boost your metabolism, okay? All right, remember, we have to fuel the body, all right? Our cells need fuel, okay? And so making sure that we are getting the appropriate amount of protein, which is very hard to do at times, the right amount of healthy carbs, okay? The right amount of healthy fats in the body, and 8 cups of water a day, okay? Making sure that we're hydrating the body properly so it can detoxify itself, all right? And so giving the body what it needs, it can help you get what you want, okay? I mentioned sleeping better, at least 7 hours of sleep a night, preferably at least 7. We got to turn the brain off. When we have thoughts running around, the body still is not asleep. Our eyes are closed, but we're not asleep. So getting the appropriate rest is key, okay? Again, I mentioned exercise. Whatever you need to do to move, we got to get moving, guys. If it's 5,000 steps a day, 10,000 steps a day, a quick YouTube video, getting some movement in your life is very, very key. Mindfulness, restoration, turning off the noise, whether it's your spiritual pathway, I go to the river very often just to kind of sit there and listen to the water, okay? Counseling also, so you can unleash some traumas in your life, meditation, prayer, things that will help you turn off the noise so you can actually relax and rest. Because again, just like if you're asleep and your mind is going, when we have a very high stressful life and we're on a go, 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 yes, our body's moving, but there's a time when it will shut down, okay? And so for me, at 40 years old, my body was shutting down. Yes, I was walking. Yes, I was still doing my job. Yes, I answered the call for everyone else, but I had to make the decision to answer the call for myself, okay? So thank you so much for this presentation. Remember, gut health is wealth, healing from the inside out, and thanks again.